morning, boys and girls. Good morning, mom and dad. This is Nurse Judith coming in from Broward Children's Center. Today we want to talk about disease and disorder that affect the vision. Okay, disease and disorder that affect the vision. Our five senses again are seeing, hearing, smelling, tasting, and feeling or touching. So those are the senses. But we're going to focus today on disease that affect the vision. Now, the vision is considered to be one of the most beautiful of all the senses. It gives you the gift of vision. You're able to see the surrounding. You're able to see your loved one faces. You're able to see the mountains, the Mother Nature. You get to see the mountains, the rainbow, the cloud, the ocean. You get to see the colors, the bright and vibrant colors around us. And so this is considered one of the most beautiful of the senses. And so we do not want to lose our vision. We want to keep it as long as we're here on earth. We want to keep our vision going. And so we're going to talk about different disease and disorder that affect our vision. Many people lost their vision because they don't know the signs and the symptoms that arouse. But what you want to make sure is to seek your physician every year. If you're 40 and over, you want to see an eye doctor every year to see what's going on with your vision. You want to test for cataract, glaucoma, and all these immaculate degeneration disease. So these are the things you want to check for, not just to check to get your glasses, but check to see if you have any disease that is on the firm that will take your vision away. Okay, so the first order we want to look at for children, a physician will recommend if you need to see the ophthalmologist. A physician will recommend that because they do a vision test when you're health screening. And so if they think the child is not seeing very well, they will recommend something be done by following up with your ophthalmologist. Okay. So the first thing we want to look at is conjunctivitis. This affects a lot of children. There are three types of conjunctivitis. There is a viral conjunctivitis, there is a bacterial conjunctivitis, and there's an allergy conjunctivitis. So you do not know which one your child may have. So you may want to seek your physician if you see a child having red, puffy eye with mucus pumping out. Mucus so thick that it cakes the eye down, that is definitely a bacterial infection. So you want to make sure you see your doctor. Now the first one we want to talk about is the viral infection. The viral infection is come from a common cold or the regular flu. And so if you have a cold or flu and the eyes get watery or get red and inflamed because you're sick and you're not feeling your very best, that is known as a viral infection, and that will go away. One thing you want to use is a warm compress. Take a washcloth, wet it under the running water, warm running water, put that bag in a Ziploc bag and apply it to your eyes, okay? Close your eyes and apply that heat for a good 20 minutes, and that will be known as a warm compress, and that will help you to release inflammation and irritant on the eye. Another one is Visine. You can use a little Visine, or you can use a little normal saline, which is a little salt and water, into the eye, and that is known as saline. Those are little bullets that they sell in the pharmacy that can use to clear the eye as well. Okay, so again, your viral infection, which is conjunctivitis. Then there's another one, the bacterial one. Now, you need to see the doctor regarding the bacterial one because the only treatment is for an antibiotic drops to treat that. So you want to see your doctor, especially if it's cakey and mucousy and swollen and puffy. You want to make sure to seek your doctor. Those things sometimes get itchy and irritable. So you want to make sure you seek professional help regarding conjunctivitis. The third conjunctivitis is known as allergy-related. Now, a lot of children during the springtime, when there's a lot of pollen out, they may have an irritant. And so Singulair and some other antihistamine may help. So this you have to seek your physician again to see if it's bacterial, if it's viral, or if it's an allergy that's causing the inflammation of the eye, the red, irritable, sometimes swollen, puffy eyes And sometimes you have pain, severe pain. The children may experience severe pain. So you want to seek your physician as early as possible when you're dealing with conjunctivitis and you're not sure what type you have. Again, 3 types of conjunctivitis: viral, bacterial, and allergy. So you want to make sure you seek your doctor regarding those. Now, there's some other things that affect the eye. One of the things that affect the eye is dry weather, a dry, humid weather that affect the eyes. A hot weather affect the eye, so you may want to wear a sunshade that may help to protect the eye. Windy weather, irritant, smoke, dust, pollen, all these things affect the eyes. So you want to wear a goggle, or you want to wear glasses. For those who work in the construction field, so those who work around sawdust, which a lot of wood chippings and stuff like that, make sure you have protective gear to protect your eyes as much as possible. Now, one of the first mild conditions is a dry eye, and that can be just from a cold weather. The colder the weather is, it blows in your eyes, it will dry your eyes out the more. And so you want to make sure, if you're having dry eye or blurred vision, to make sure you have moisturizers or lubricant, and this is where your eye drops will come in to protect your eyes. So for some, you may have to seek a physician to get certain things. Some of these things you can get over the counter. Just talk to your pharmacist, and they'll tell you if you're having dry eye. And if it's get too dry, and if you're constantly having this problem, it may be more than just a dry eye. So you may want to seek your physician help there. Again, sometimes we don't eat enough, we don't eat proper nutrition, and so that will affect our eyes as well. Things like omega-3, which is fat, good fat. So you want to make sure you have enough moisture. These provide lubricant for your eyes, so make sure you're having enough omega-3 fatty acid. Now, we're going to look at some eye disorder, and one of the news is lazy eye. One of the first one is lazy eye. It's where one of the eye is not as strong as the other eye. And so you may see children wearing eye patches. They will cover the stronger eye so they can get the weaker eye to get involved. So that will, they may be in for 2 hours or maybe less, some maybe more. So it depends on what the doctor recommends, and this will be done by an ophthalmologist. He will recommend if the eye should be, if they should use it for 2 hours or less hours. Okay, again, it's an eye patch to encourage the weaker eye to be more active. So you cover the strong eye and you get the weaker eye to be more involved. So that is known as the lazy eye. The other one is astigmatism. And that's have to do with the shape of the eye. Some people's eyes are, oval, and others are like we call oval. So it's all round and then it's oval. So it depends on the shape of the eye, the curvature of the eye. That's known as astigmatism. And that most doctors can have specific glasses and specific contact lens to help with those with astigmatism. Again, these are just eye disorder. Okay, we can go on to myopia. This is what Miss Judith has. Nearsighted. Myopia is known as nearsighted. And you have farsight and you have nearsighted. Most young people and children will have the nearsighted. So they have a problem seeing the chalkboard from a distance. So they may have problem seeing the screen from a distance as well. So they may use corrective lens so we can see the things at a distance. We see our books, and if you see a child, reading a book and they're bringing it up close, chances are your child already have myopia. So you want to make sure you get corrective lens so the child can see distant as well as the things close. Again, that is just a disorder where you see closer than you see further. Then the opposite, which is people with far distant, they see things at a distance. And that is usually older people, going over 50 or 60. You may see that you may have myopia, and then gradually you start pulling things away from you and you want to see at a distance. So that's known as, that is the opposite of myopia, which is farsight. Okay, so yeah, the short distance, nearsightedness, and farsightedness. And those people need those things, glasses for driving and certain things ahead of time. Another thing is known as Strabismus, that's strabismus. It's known as the cross eye. Another word is used as cross eye. That's where the eye alignment, it's not aligned properly. So the child may see outward or see inward, depends on how it is. That is also known as an abnormal alignment of the eye. It can be inward alignment or outward alignment. And these can be fixed as well. They may need corrective surgery. So whatever necessary you may seek your physician. He can make recommendation, and from that you can go on and you have seen better vision, and the lens can be corrected. Again, it can be aligned so the child see very well. Then there are disease. There are disease that destroy the vision and can lead to blindness. And so these diseases can come from not having enough nutrient. So it is important that not only do you see a physician, but ask your physician to recommend a nutritionist. The most thing we put in our body is food. So we want to make sure we see a nutritionist to recommend the necessary food that we can have proper vision, we can have a healthy immune system. So we want to see these doctors and these nutritionists so that they can make recommendation as to what we need to allow in our diet and what we need to take out of our diet to make sure we are getting the maximum health in our body. Macular degeneration. And this is a progressive vision impairment resulting from deterioration of the central part of the retina known as the macular. And so these, you want to make sure you see your doctor again. These can be fixed early if they catch early by nutritional treatment, sometimes surgical treatment, but whatever it takes to see better. Because as I tell you, your vision is one of the most beautiful of the senses. And a lot of people out there cannot see because of nutritional problem or disease or something else to their vision. Another one is glaucoma, damage over the years to the optic nerves. And you mostly see this in diabetics. People who have a high blood sugar, who are constantly pushing insulin in their body, pushing back that high sugar into the system, it is doing damage to nerves. It's doing damage to organs. And over the period of time, you will see you may lose your vision because of the high blood sugar. Again, I recommend, if your physician is the only person you contact regarding your health, you're in a serious problem. You need to see a nutritionist, and they will help you solve these problems. One of the things I always said, food. When you need to come to your food, you need to see a nutritionist. When it comes to disease that you're dealing with, not all disease is a medical disease. Some are nutritional, and the only solution is through a nutritional aspect. So you cannot solve a medical problem that is nutritional, and you can't solve a nutritional problem medically. You have to seek the right measures, and by seeing a nutritionist and an herbalist will help you solve some of these medical problems. Another one is cataract. Cataract is a disorder, a condition that causes cloudiness of the lens when a protein is built up to form clumps, and these protein build up over the years is attached. It attacks the lens, and it builds up on the lens. So you just need to clean that lens, and that may be done through surgery by cleaning that lens and go back in. Another problem is that when most people have these problems, they go back to the same diet. And so they will have a cloudy lens in a couple of years again. You have to find a nutritionist that can recommend food that will protect your lens, that will protect your maculars, that will protect your retina so that you can live long and a healthy life with all your senses intact. All right? Now, there's some people who are colorblind. They are definitely colorblind. They cannot see colors. They cannot see bright red colors and green colors and yellow colors. They can't tell the difference. And so it is important, if your child is colorblind, that you let your teacher be aware of it or other family member be aware of it, because this will have problem having just simple tasks like getting themselves dressed. You know, that's a simple task. Seeing the traffic lights, the red, the green, the yellow. And so not all the people that run the red light is necessarily, you know, people who are doing it carelessly. Some people are definitely colorblind. And these things should be addressed even before they drive. It should be on their driver's license that they have a problem with color blindness. And so they don't see things the way other people see it. And so it is important that you let your teachers, let the family be aware that your child is colorblind. And it's not that they don't know the color. They just can't identify it because they're colorblind. So, simple tasks like getting their clothing changed, picking out a ripe fruit. They go to the market and they can't pick out the ripe fruit because they are colorblind. They can't see the difference. So it is important that the family be aware of this. Now, there's some disease that can affect your vision. Again, we talk about diabetes. It's a nutritional problem. So you need to solve it nutritionally. Okay, so diabetes is one that can destroy your optic nerve. Each day you have a high blood sugar, and you use the insulin to push it back into the system, it is affecting your organs, it is affecting your vision, it's affecting optic nerves that can later lead to blindness. So it has to be controlled. You want to control that blood sugar as fast and as easy as possible, and by getting some nutritional tip from a nutritionist. Another one is autoimmune disease. Somebody dealing with rheumatoid arthritis, lupus, muscular dystrophy, different kind of inflammation that affect your joints and your body and your immune system. You may want to see a nutritionist again to help you build your immune system. We're going through the coronavirus here. It's an immune thing. It's a thing that affects those who have a poor immune system. So you want to build your immune system. You want to make sure you take your zinc. You want to make sure you take your food that is will build immune system. Vitamin C, vitamin D. You want to make sure you get those. You want to make sure you get your selenium and your zinc. These can prevent the disease and build your immune system so you can fight these infections, because you do not know what you're surrounded with. You do not know what you come in contact with. So the best thing is to have a strong immune system so you can fight cancer. You can fight any form of disease by just using these vitamins and minerals. So you need to see, again, a nutritionist, so you can be encouraged what to eat to build your immune system, what you can eat to reduce inflammation. So by doing these things, you can, fight any infection, including the coronavirus. You fight it faster if you're taking these vitamins and minerals. Infectious disease, those who have HIV, meningitis, these things, these infections set you back, because now you are dealing with an infection day in and day out. Every morning you get up, you still have this infection and it's not going away. So you want to, again, build your immune system. And most of these HIV patients are taking cocktail mixtures of zinc and selenium to keep the virus from multiplying in their system. The same thing for the coronavirus. What you want to do is to inhabit it from multiplying. If one or two get in your system, you take that zinc, you keep it from multiplying and take over your system. The same thing with HIV. You keep it from multiplying, because it will take over your immune system, take over your body, and before you know, you're not here because of just a simple thing as a poor immune system, which can be built, which can be repaired. So that's what you have to do. It's not just a doctor you have to seek. You have to seek a nutritionist, an herbalist. They can help you. There's treatment for glaucoma. You can go seek an herbalist. They can recommend these. Now, another thing that affects our vision is nutrition. Again, we can't stress enough. You need to have nutritious food. There's certain vitamins and minerals that are essential for vision. Vitamin C, vitamin E, omega-3, lutein, zinc. All these are essential nutrients that you need. Vitamin A, you need vitamin A for your vision. So you need to know these things ahead of time so you can protect your vision and have it here for a long, long time. People with sickle cell anemia. Sickle cell anemia is where the red blood cell, instead of being round like a donut full of oxygen, it is ill-shaped. And because of the ill-shapedness, it's not enough oxygen is being carried into it. And so that person is deprived of oxygen and of poor circulation. So they have a lot of aches and a lot of pain. So you want to make sure if you have sickle cell anemia that you seek a nutritionist. They can help you with iron-rich food and also to build your immune system. The last one we're going to talk about is liver disease. A lot of people have like liver cancer, or they may have jaundice, which is the eye will change to yellow. The white part of the eye, which is the sclera, will change to yellow. And so that you have to seek, again, there's certain herbalists that can tell you things to clean the liver, cleanse the liver, remove toxin from the liver. And so these are the things that can affect your vision, not just nutrition, but disease that can also affect your vision. And again, I said, the vision is one of the most beautiful sights, and you want to keep it as long as you can. If you need to wear a pair of glasses, go ahead, protect yourself. Goggles, protect yourself. But what you need to do is to keep that vision as long as you can, and by eating nutritious food, by find out if you have a disease, then you address it nutritionally as well as medically, so you can get the optimum best of your health and stay healthy, live longer, and so you can be here for your family and friends. Have a great day, and thank you for tuning in. Thank you, Mom and Dad. Thank you, boys and girls. Have a great day now. Stay healthy. Bye.